Welcome to a new episode of our weekly web series Science in Context. A recent study explored the association between HIV status disclosure to adolescents, their mental health, adherence to treatment, and viral suppression. I'm Sabine, and joining me today is Olanrewaju Edun. Lanre, can you explain what disclosure is exactly and why it is important to managing HIV care for adolescents?
So thank you, Sabine. So disclosure to adolescents in the context of this study really refers to a process whereby children who are living with prenatally acquired HIV are informed that they are HIV positive in an age-appropriate manner. And so disclosure is particularly important for managing HIV in adolescents because they tend to start antiretroviral therapy at a very young age, even before they are aware that they are HIV positive. And so as they get older, they start to question the need for the daily medication that they are on. And so disclosure really just provides an opportunity to kickstart that conversation and can help them attain medication-taking autonomy.
Your study followed up adolescents in the Eastern Cape of South Africa for a period of 4 years. What were your main findings?
So thanks to our collaborators at the Universities of Cape Town and Oxford, we had data on this very large group of adolescents living with HIV. And so what we found amongst them was that age was the main driver of disclosure. And so older age adolescents were more likely to be disclosed to. We also found that contrary to the fears of caregivers that disclosure worsens mental health symptoms, we found no difference in mental health symptoms between adolescents who were disclosed to and those who were not disclosed to during the course of this study. However, we found that there was a drop in adherence amongst those who were disclosed to, which was not observed amongst those who were not disclosed to. But this drop in adherence was not sustained at the subsequent study round. And lastly, we found that amongst all of the adolescents, regardless of when they were disclosed to, disclosure was not linked to poorer mental health, poorer adherence to antiretroviral therapy, or poorer viral suppression rates.
And given these findings, what does that mean for the management of HIV care for adolescents going forward?
These findings really just provides evidence to support the WHO recommendation for timely disclosure to adolescents, as it's unlikely to lead to poorer mental health, poorer ART adherence, or lower rates of viral suppression. However, it's still very important to provide adherence support to adolescents as they undergo this disclosure process.
Thank you so much for your time.
Thank you.